Enhancing Quality of Life Through Hospice Care. Hi, my name is Janie Acosta, and I am an LVN as well as an RCFE administrator. I work for Care Choices Hospice and Home Health, providing education for our community partners. Today we're going to be talking about the basics of hospice. I hope you enjoy this presentation. So what is hospice? It's a special concept of care focused on providing comfort, relieving symptoms, and offering support for persons with life-limiting conditions, and offering support for their loved ones. It is a holistic approach to care that considers the physical, emotional, social, and spiritual aspects of the patient. The focus of hospice care is on caring, not curing. Curative care versus comfort care. Curative care is disease-driven. The doctor is in charge. The disease process is primary, and there are fewer choices. Comfort care is symptom-driven. The patient is in charge. The disease process is secondary to the person. There are many choices. Comfort and quality of life are the focus. The philosophy of hospice care is to provide quality, compassionate care for people facing a life-limiting condition. A multidisciplinary team approach with a focus on support and care for the individual needs of a patient and family. The goal is to live as fully and as comfortably as possible while preparing for death. Hospice philosophy is based on the belief that the dying process is a part of the normal process of living. The quality of life remaining can be enhanced. Hospice should neither hasten nor postpone death, but rather walk alongside the patient. Where is hospice care delivered? Hospice care is typically delivered in the patient's home, which can be a private home, a residential care facility, assisted living facility, nursing home, or board and care. It can also be delivered in an inpatient hospice facility. Some of the components of the hospice team are, or of the hospice rather, this hospice team, durable medical equipment and supplies, and medications. Let's talk about the hospice team. It's a holistic view of the resident, requires a team approach. The patient and family are at the core of the hospice team, as you can see in the diagram. The interdisciplinary team consists of the physician, the nurse, the social worker, the chaplain or spiritual counselor, therapists, home health aide, bereavement counselor, and volunteers. The physician is there to provide support and to give the nurses guidance in managing the patient's symptoms, whether it be pain, anxiety, or any other symptoms they may be experiencing. The nurse is there to assess the patient on a regular basis. They make regular visits to the patient's home. They meet with the patient and the family, and they address any issues that the patient is physically experiencing. The social worker is available to offer support to the family in any way they can, whether it be community resources or helping them to make arrangements once the loved one has passed. The chaplain and pastoral counselor is available for spiritual support and guidance. Therapists are available if the patient needs physical therapy, occupational therapy, or speech therapy at any time. There's also home health aides. Home health aides will visit the patient and may assist with bathing or some of the activities of daily living that the patient might need help with. And there's also volunteers that are available to visit the patient to provide an added support. The bereavement counselor follows the family of the patient once the patient has passed away. Typically, the bereavement counselor will contact the family on a regular basis up to 15 months after the patient has passed to ensure that the family is grieving appropriately and has the support systems that they need. The next component is the medical equipment and supplies. Any equipment that is needed, such as a hospital bed, wheelchair, or other supplies, are provided and covered through the hospice benefit. Medications are also covered as well. Anything that is related to the hospice diagnosis, and it is there to relieve symptoms for the patient. Who is eligible for hospice? Well, there is a criteria. The criteria is that the patient must have a prognosis of life expectancy of 6 months or less if the disease takes its expected course. 2 physicians must verify that this is true. The patient, if competent, or the responsible party, if the patient is not competent, wants hospice services. A documented clinical progression of the disease, for example, progression of primary disease process, multiple ER visits and/or inpatient hospitalization over the prior 6 months, are other criteria that may qualify somebody to go on to hospice. There also must be a functional decline, recent decline, diminished functional status, such as dependence in at least 6 or at least 3 of the 6 activities of daily living. Documented recent impaired nutritional status related to the terminal process. So this could be the patient has been eating less, is losing weight, and is not thriving. Who pays for hospice care? There are multiple sources of payment, some of which are Medicare, Medi-Cal, most private insurance plans and HMOs, private pay, or charitable foundations if there is no payer source. We believe everybody deserves hospice if they need it and want it. So the summary is that the goal of hospice care is to maintain the highest level of dignity, comfort, and quality of life possible for patient, family, and loved ones. Final thoughts. You matter because you are. You matter at the last moment of life, and we will do all we can, not only to help you die peacefully, but to also live until you die. From Dame Cicely Saunders, thought to be the pioneer of palliative care. Thank you so much, and you can contact us at any time by going to our website, www.carechoices.net.